Republican Senator John Barrasso of Wyoming, who was also an orthopedic surgeon for 24 years, is my guest now. Good morning, sir.
Morning. Great to be with you.
It's great to have you. You know, people here, we're going to look like Canada and Great Britain after this plan is done, and they get a little nervous. We've been covering this for a couple of weeks now here in America's Newsroom, and they are talking about over in those countries waiting lists to get on the waiting lists to see a GYN doctor, to see a neurosurgeon, something I'm thinking if you need to see a neurosurgeon, you need to get in pretty soon. Is that realistic here in this country, or is that just scare tactics by people who oppose this plan?
Well, I think if you look at what's happened in other countries like Canada and like Britain, that's what's going to happen in the United States if they get this one-payer plan that they're shooting for. They call it Medicare for all, and you know Medicare is the program that has the most fraud and the most abuse and the most waste of any government program that has to do with health care. I think it would be a disaster to have Washington take over medical care. I was the speaker yesterday at Georgetown's commencement at their medical school, and I said that what we're doing now in Washington is going to have a huge impact on the way patients are cared for, health care is paid for as well, and in terms of the issues of all of how medicine is practiced. Because when you look at this, and I've seen it from both sides, both as a doctor as well as a husband. My wife is a breast cancer survivor, had 3 operations, two whole series of chemotherapy, radiation, and she survives because we're in America. We're in the United States, the best healthcare system in the world. The survival rates for people with cancer in America is much better than Canada, much better than England or any place else in the world where they have one of these government-run takeovers of medicine.
Why is that? Because, I mean, just looking forward to how it could be in this country, you're telling me there's going to be so much bureaucracy, the government's going to have so much say in the treatments we get that they get delayed to the point where they're no longer going to be helpful to us?
That's exactly right. Decisions about your health care ought to be made by you and your doctor, not by a Washington bureaucrat, not by an insurance bureaucrat.
But
no
Barack
one
Obama
should
swears
stand
that
between
that
you
will
and your doctor.
continue to be the case. He swears he agrees with you, and he says he is not signing on for any health care program that will change it so that medical decisions won't be between the patient and his doctor.
Well, although in his stimulus package that you take a look at that, and there's over $1 billion for a whole program set up with a board that's going to oversee and then make decisions based on economics about what treatment they view as helpful or not, and it's going to come down to economics. In Canada, and I'm an orthopedic surgeon, if you're in Canada, they decide how many joints they're going to have replaced that year, whether additional people stand in line or not. When they run out of money in that program, usually around Halloween, then there are no more artificial joints for the rest of the year. I mean, that's what rationing is about. People have to wait in line, treatment is delayed, tests are delayed, treatment ultimately is denied because often in other countries, people die while waiting for their care, Megyn.
That's why you've got Canadians coming across the border to get their health care here in the United States, and the question a lot of people are asking is, where are we going to go? If we become the new Canada, what border do we head across? Certainly not the Mexican or the Canadian. But let me ask you this, because Barack Obama has said repeatedly, I'm only dealing with the people who don't have insurance. Obviously, getting some sort of insurance, even if it's this kind of insurance, is better for them than having nothing. And if you are sitting at home right now and you're employed through your own or your spouse's insurance, I'm not messing with it. Why do you reject that?
Well, that's what he's saying, but this is a 2-step process that they have, one with their public plan, which is going to lead to everyone covered by that plan, and that's the way they're really going to control costs in this country. And those programs, to me, are bad for people. They're bad for patients, they're bad for providers, whether it's doctors or nurses, and they're bad for payers, the people that pay for it, which are the taxpayers of America. You know, in my practice, what I see is people are very smart consumers when it has to do with their own dollars. But when $6 out of $7 in health care isn't paid for out of their own pockets, they don't really watch carefully how insurance dollars are paid, and I understand that completely. But Megyn, half of all the money we spend in this country on health care is spent on just 5% of the people. And those are people that eat too much, exercise too little, and smoke. And if we can get a handle on those 5% and help them, we can save an incredible amount of money. But this system that we have is really upside down, and that's what I told the graduates yesterday at Georgetown Medical School.
So
this is a system that pays us to do more for people rather than encourage us to help try to keep people healthy.
Well, there you have it. There's an alternative solution to those who say that people like you, Senator, are just part of the just say no crowd without an alternate solution. You, as a doctor,
there are other
have
solutions.
some ideas on that. Senator Barrasso, thanks so much for coming on. I hope you come back.
I'll be happy to come back every week to talk about health care. It's a critical thing for the future of our country.
And
Thanks,
you know
Megyn.
what? Our viewers are saying the same things. We get tons of emails about it. Thanks so much, sir.